Hi everyone, welcome back to the channel. Today I will be talking about something that affects millions of people around the world, and that something is called keloid. Keloid is a disease of the skin. You see those thick raised scars that keep growing long after a wound has healed. Those are called keloids. So in today's video, we are going to talk about the reasons why they happen in the first place. We need to talk about those who these keloids affect most. I mean, those who are at risk of having keloids. I will need to talk about the best treatment options. I will need to talk about the causes of keloids. And if you are able to stay to the end, I will give you some of the tips you need to follow to prevent keloids in case you are prone to having keloids. By the way, if today is the first time of seeing our videos, I will plead with you to click the like button, subscribe to the channel, and share the video. You may never know who may need that information. And the more you click and share, the YouTube algorithm may begin to recommend our videos to those who may need it. Alright, so without wasting more time, let us get started. First of all, let's define what is keloid. Keloids are often confused from scars, though they are scars, but they differ from regular scars that often go away by themselves. Keloids, if left untreated, can grow and grow and grow and grow far beyond the boundaries of the original wound, the boundaries of where they started. It could stretch forth, it could extend to very many areas, and that could cause disfiguration of the skin. So having said that, let's talk about the causes of keloid. Several research have been done on causes of keloids. I'm going to talk about them, and I'm also going to mention some of the personal research I've done regarding keloids, just to make sure you are fully grounded about what can cause a keloid. Number one is genetic factors. If by any way you have somebody, maybe your parent, your mother, or relative who have keloids, the propensity of you developing keloid is higher than someone who's never have a hereditary issue. I mean, someone whose parents or previous ancestors do not have keloids. Number two is hormone and inflammation. Chronic inflammation can make keloids to get worse. Chronic inflammation and hormone changes. If you have very drastic hormone changes, either as a result of drugs, chemicals, food, sickness, medication, those can trigger keloid development. The next factor of what causes keloid is age. Age is not a very pronounced factor, but research has shown that those between the ages of 10 and 30 are more prone to have keloid than those below 10 or above 30. The next factor will be the site, the type of skin. Most people who have darker skins, I mean people of color from Africa, Asia, and Latin America, people from those regions are more prone to develop keloids. The next causes of keloids can also be linked to the site of the keloids. Keloids often develop more in certain areas of the body. For example, on your chest, on your cheek, on your neck, and your back. Those areas are prone. If you have injuries in those areas, you are prone to developing keloids, probably because of the amount of collagen that is developed in this area. Another factor that could cause keloid is injury. Of course, that is a direct factor. Injury can be as a result of cuts, acid burn, regular injury like bruises, mosquito bites, pimples, tattoos, ear piercing. These factors can trigger keloid formation. Now we'll talk about differences between small keloid and big keloid. Big keloids are those very stubborn killers that have stayed for years on ending without no recourse. They are not receding, but they are always growing and growing. Any keloid that is above half inch can be considered a big keloid. But if it's less than half an inch, we can consider that a small keloid. And there's a different treatment approach for big keloid and for small keloid. Now, what are the treatment options? Let us start with the smaller keloid, like we talked earlier. If you have little keloids that are very small, probably less than half an inch, still developing, new, fresh, the best and easy treatment for such a keloid is silicone gel or silicone patches or sheets. Place it on that area for several months, at least 12 to 18 months, to see reduction in those keloids. For bigger keloids, silicone patches are useless. They will not give an impact. So if you are developing a little keloid, maybe from pimples, maybe from surgery, maybe from CS, maybe from ear piercing, as they are starting immediately, start with silicone gel or silicone sheet, and ensure you use it for a long time, at least 12 to 18 months, for you to see the efficacy. The second treatment option is corticosteroid injection or cream. One of the most common corticosteroid is Keloid. If you have small to big keloid, you can use Keloid cream combined with Keloid injection. The injections can be taken every 4 weeks for a long time, or as prescribed by your doctor, while you're also using the Keloid cream or any other brand that is available. So that is the first line of treatment. The next line of treatment, which is the third one, is cryotherapy. And this is the process of using nitrogen gas to compress, to freeze the skin. Nitrogen gas is very low in temperature. Could be as low as minus 250 degrees centigrade. So you use it to freeze the skin to ensure it does no longer grow. Alright, so the next treatment option will be laser treatment. And so laser treatment could be expensive, but that is the next line of treatment. Now, these treatments I've just mentioned are all effective for small keloids. But for the very big and stubborn keloids that is greater than half an inch, the first line of action of treatment should be a combination treatment. One, you start with Keloid, ask a doctor about Keloid injection and the cream. Combine the injection. Use the injection at least every 3 weeks or 4 weeks for several months, or as prescribed by your doctor, and use the cream as well. You can take care of keloid if you're able to consistently use it for a long time. But however, your doctor needs to watch out for the side effect of this steroid, because it is a steroid. It can impact so many areas of your body system, your libido, your general health. All right? The next line of treatment will be surgery. If the keloid is bigger than 1 inch, the best option will be surgery. But you see, surgery alone will not be a solution. If you do just surgery and didn't do any follow-up treatment, the keloid will come back even worse. So the recommended strategy to treat large keloid is to do surgery to remove the keloids and do a follow-up course with Keloid injections for at least 1 year. Or you do laser treatment immediately after the surgery. With these methods, surgery can be another effective way of taking care of keloids. Now we'll talk about cryosurgery and radiation. These are also treatment options, but because of their side effects, I highly recommend using the routes. So, having talked about what are keloids, the causes and treatment options, there are other options you can use at home. They are not 100% effective, but they at least will help the keloids not to continue to grow and grow more than where they are. Number one, ask your doctor to recommend Keloid cream for you. Your doctor ensure gives you Keloid injection at least once a month. You can use aloe vera to reduce the itching. Once you are itching, the keloid is going to get worse. You can also ensure you take care of anything that causes inflammation in your body. Chronic inflammation is not good for keloid. It's going to make it worse. So You have to control any sort of inflammation in your body. Make sure by making sure that if you have any sickness that is not other than keloid, that you take care of them. Avoid the excessive sugars, avoid the excessive salts. If you have diabetes or hypertension, take care of them, because keloid will make keloid even worse. Then honey is also another important one to keep the skin moisturized. Keloid need to be kept moisturized and not dry. The vitamin E is also so helpful, as it helps to control, as it helps to soften scar, even though the results are not always effective. So if you want to treat keloid from home, I will recommend one. Continue to take multivitamins, especially vitamin D, vitamin E, and the B complexes. They will help to your body to keep functioning the way they should function. If you have inflammation, make sure you get rid of any inflammation in your body, which could be as a result of excess sugar or sickness or disease. So I'll mention taking multivitamins. Make sure you don't overstress yourself. Ensure you take action immediately you have any injury. Avoid doing tattoos. Avoid ear piercing as much as you can. If you are pregnant and you need to do CS, tell your doctor ahead of time. Now, another method you can use from home is pressure. If you put pressure on any keloid long enough, the keloid will melt away, especially those keloids that are less than half an inch. Putting pressure, like maybe tying a belt around it, just anything that could put pressure on the keloid for a long time. If it's around your waist, tying your regular belt is perfect. If you do that for a long time, for maybe a year or two, the keloids will melt away. All right, so that is it for today for keloids. If there's any point I didn't mention, do say so in the comment section. Thank you. See you again in the next video.